Welcome back to Living Dayton, everyone. You may also know this face as our own Tara Hastings. Welcome, Tara.
Well, thank you. This is a little awkward being on a guest.
I know, you're here for a different reason.
I am.
She's here to share with us her own personal story. She's been touched a number of times by breast cancer. Several of her close family members have faced the disease, and now she's going to share with us your journey.
Yes, I have a strong family history of breast cancer. My grandmother had it in, I don't know exactly when, but in her late 30s, early 40s.
Wow,
a long time ago when chemotherapy was just in its infancy. And then my mom had breast cancer at 39. She is now 15 years breast cancer free.
Good
so
for
that's
her.
exciting.
Congratulations.
And then one other, my grandmother's sister, so my great aunt, also was faced with this disease. So I have a very strong family history. And on my 30th birthday, I went and got my first mammogram.
Good for you.
Yeah, because family history is very important to me, but this is one family history that I am, one tradition that I really want to break.
Yes, and so for you, the key was early detection, making sure you're going there all the time and being on top of those mammograms, right?
Absolutely. Every year I go. So I'm actually going tomorrow.
You're going tomorrow?
Tomorrow I'm going to go and get my mammogram, and you know, they really don't hurt that much. A lot of people are very worried about the pain.
Ask you, yeah, a lot of people put it off because they're either embarrassed or they're afraid. But
and
I mean, you've been through it a number of times now, so.
It's really not bad. It's slightly discomfort. There is some discomfort.
Right.
I'm not going to lie, but honestly, it doesn't hurt. And I did have to get, you know, I had my baseline mammogram done when I was 30, and because they didn't have anything to compare it to, I did have to get a little bit more in-depth testing because they did find something. And that did involve a little bit more discomfort.
Yeah.
However, they found that it was just probably a lymph node that was in my breast.
Right. And I mean, doesn't it give you peace of mind to
Absolutely.
go in there and get a clean bill every time?
Well, and I use humor. My mom used humor a lot when she was going through her surgery and disease, and I use it as well. I say, okay, I'm going to go get squished tomorrow. You know what I mean? Because it is, and it's, you know, if you do use humor a lot, it really helps. Kind of like an extra medicine, I think.
And early detection is the key. We hear it a lot
100%.
in the media. Yeah, absolutely. Well, thank you for sharing your personal story, but now we're going to jump up over here. If Tara, if you'll follow me.
I will follow you.
All right, we're going to sit down over here. Hello, Dr. Rob.
Hello, how are you?
Look, we match.
I know.
Yes,
we called each other ahead, and I
forgot about the pink memo today.
That's
but
okay.
at least you guys are doing the pink for us.
Wait till you see the pink pumpkin.
Yes, that's a little bit later. All right, everyone, this is Dr. Rob, America's Fitness Doctor. He's going to join us to cover breast health guidelines and the signs and symptoms to look out for. So let's take it away. What are the guidelines? There was some controversy with that because they changed a little bit.
Yes.
They do change all the time, and what you have to think about is prevention. And in Tara's case, she has such a strong family history that you have to take it on an individual basis. So the rules kind of don't apply there. That strong family history of her grandmother, her mother, and then other people in your family really need to be aggressive and make sure that she's having her annual exams and mammograms.
Okay.
For most people, though, that's not the case. What we do know is that in the United States in 2012, about 290,000 women will get breast cancer. And out of that, there's going to be about 40,000 women that will die from breast cancer this year. Those are pretty staggering numbers. What's disturbing, though, is there was a study that was done, and it revealed that only 3 out of 100 women knew the signs and symptoms of breast cancer.
Okay.
And that's kind of scary because you really need to know what you're looking for in order to find it.
And know to look for something at all, because I didn't realize that there were signs or symptoms at all. It was kind of silent, right?
Well, there are signs and symptoms.
Yeah.
We
Okay,
can
so
talk
what are
about
some
that.
of those?
And I like to tell my patients, TLC, treat your breasts with TLC. Touch them, look at them, and if you find something, go to your doctor so they can check it out.
TLC.
So things like a nipple that starts to turn a different way or goes back in, a rash on the breast, a lump that you feel when you're checking your breast,
right.
a discharge from the nipple, or an irritation of the breast are all signs that need to be checked out. So if you touch your breast on a monthly basis, which is breast self-exam, and a good place to do that is in the privacy of your shower when the breast is wet, your hand slides over the breast, much easier. And then if you do find something, to go to your doctor and get it checked out. If you're over 40, you should have your mammograms annually, and you should have your clinical breast exam done by a doctor annually.
But then if you're at high risk like Tara is, those things change, right? Because you've been doing it since you were 30.
Yes,
Yeah.
and you know, and I want to point out too that technology has changed so much. I just got my mammogram in Dayton last year, and I go in there, and of course the woman says, the mammogram tech, well, I hope that you have a doctor's note because you're too young. And I said, yes, you know, I have a strong family history. And I went in there, but the neat thing is the mammograms, when they put your breast on there and they tighten it up, the tech goes around, pushes a button, and as soon as the picture is taken, the pressure is released off of the machine.
Immediately.
And I was so excited about that because
it is exciting.
Because just that little tiny pressure being taken off as soon as possible was amazing.
It makes an incredible difference, the new technology that's out compared to 10 years ago when the tech would have to come out and lift everything
And lift everything up. And so you don't have to wait for that anymore.
It's the little things that make it just a little bit better, right?
I got really excited about that.
Well, it's a good thing. Nobody wants to have those squished together.
More incentive. Tara, give a shout out to people who are just about to go, maybe scared to go. What do you want to say to them?
You know, don't be scared. It is really not that big of a deal. And you know, if you go and you get this done, early detection really is the key. And you go and you get it done, and it literally can save your life. So don't be afraid.
Tara, thank you so much for joining us on our Living Dayton set for once instead of over in the winter
Yeah,
set.
thank you for
Lovely
having
to
me
have
over
you.
here.
And stick around. Dr. Rob is going to be with us a little bit later on the show in the Lifestyle Kitchen. Thank you for this, Dr.